as part of your treatment protocol with this underwater treadmill and all the things that you're doing, is one of the ideas in the type of medicine that you practice to get the dog or the cat off as many of the meds as possible?
Yes. Plain and simple, yes. Hi, this is Dr. Randy from Pause, Reflect, and Heal. Welcome to our podcast today. This is the first of our new year, and got some exciting news with me. You'll see a face that may not be obvious to all of you, but I want to introduce my good friend Mark Drucker from the lovedog.com podcasts. Many of you have listened to that podcast that I did with Mark. It was a 2-part series. It was really fabulous. And we both decided that this would be a great association for someone to come along and act or be in the role of our pet parent. Mark understands the things that many of you are going through. He has a dog, Hank, of his own, and we have addressed some issues and will address some issues down the road. But I think this is a really good association. So if you get a chance, go back to lovedog.com and listen to some of the podcasts. They're very informative. Mark had some great guests on, but he's going to be here helping us with Pause, Reflect, and Heal, and we're very excited to have him on board. So Mark, welcome this morning.
That is so nice of you, and I could not be happier to be here doing this with you. I think it's going to be a really productive collaboration. I am attracted to your work because of what you do, the whole holistic, integrative space that you are in and are known for, and it's something that, appeals to me for my own health. And I think it becomes a values-based kind of thing. If I do it for myself, hey, why not try it for my pet? In my case, for my dog. And that is exactly how I have approached my dog's health. I'm now on my 3rd dog, and I've seen the benefits. And what I want to say just at the get-go is that there obviously are benefits, at least from my point of view, benefits to the holistic integrative approach that you take, and also the allopathic Western approach that you always or often mix into your work. And there's a time and a place for both. And right. I feel like you really have your eye on that, and you know exactly what you're doing when it comes to that, in my experience in talking with you. So I couldn't be happier to be here. And what we're going to talk about today is arthritis. Joint pain in pets, where it leads to typically arthritis, especially in older dogs and cats. And I've had my own experience with it. I've had 2 Goldens that came down with arthritis when they were about 8 or 9. My second Golden just one day was jumping up on the bed and his hind legs collapsed. So then begins the whole, well, what do I do? And how long can this dog go on like this? And how do I treat it? And how do I manage it? And to be honest, I never really found the traditional approaches very effective. Right. I mean, just some medication, some Remedil, whatever, it takes away the pain, it works for a day or two, then you have to go back to it. So that to me is not the greatest way to go about something. And I think here we are, it's 2025 now. Happy New Year, by the way. And there's lots of stuff that we can do. So let's make this a conversation about pet arthritis and joint health in our pets, and let's touch a bit on senior dogs as well, because it's big in that area.
Sure.
And we both know that joint health is central to a dog's health and enjoyment of their life on the planet, because it's about mobility and being able to move around freely and without pain. So I could not be more excited to be here and to talk about this, to lead this season off, because I know it's a condition that so many pet parents are dealing with. And I hope you don't mind, Dr. Randy, but I'm going to be picking your brain a bit.
No, it's whatever's left of it at my age, we're in good shape, Mark.
I'm not that far behind you, and let's just get going.
Sure.
Let's just get going and have a good time here.
So you mentioned arthritis, and let's tell the listeners that arthritis is basically defined as pain, inflammation, heat, swelling in a joint. And in our dogs, who are quadrupeds, that they move differently than we do. We have all four legs to consider, plus their cervical, thoracic, lumbar, and sacral spine. And so arthritis in humans takes a position of there's osteoarthritis, there's psoriatic arthritis, there's rheumatoid arthritis. We do see some of those other things, but really osteoarthritis is the condition we want to talk about today. And so, in our world, the most common things that pet parents come to us for are arthritis, cancer, GI issues, and skin allergies. So we're really glad to be opening up season 2 with arthritis because it's so prevalent. And, we are seeing it in younger and younger animals. And so let's try to take the mystery out of arthritis and how do we manage this for our pet parents who listen to Pause, Reflect, and Heal.
Yeah, I think that's perfect. And I think a good place to start is just joint pain in pets in general and signs that your pet needs arthritis treatment. And I think, you're watching your pet, you're a vigilant parent, and you see that your dog may have some trouble moving around. It starts out as trouble getting up. As I said in my case, all of a sudden my dog's hind legs collapsed when he tried to get up on the bed.
Right.
So let's first talk about, okay, I'm going to take the dog in to see Dr. Randy, to see my vet. We're going to want to diagnose this. So let's just talk a little bit about what the diagnosis process looks like.
Sure. No, great question. So I would say on a weekly basis, I probably get 2 to 5 cases presenting just like Mark elucidated in his pet. And they come in, people will come in, pet parents, they're worried because they're first seeing the dog or cat, we do see cats too, obviously, but that are having trouble, let's say, getting up on the bed. They used to get up on a chair or they used to jump up to say hello and they're not doing that. But also many times we see them coming in with a diagnosis or a question about limping. So there's an individual limb that's obvious that when the dog is walking, possibly is not full weight bearing or having issues. So the most important thing when we talk about this is finding where the issue is, obviously. So this requires a really good physical exam. And we always tell people when they're listening to our podcast, you see these signs, we really want you to get to your veterinarian because earlier in the diagnosis and therapy, the better off we are for helping our animals. So we do a great physical examination here at what we call the CoLab, which is our rehabilitation center at Paws Veterinary Center here in Tucson. And we start from head to toe. And many, many times people will come in. One of the things that I wanted to make sure I tell our listeners is sometimes the limping or the mobility problem isn't a pain problem, meaning it's not osteoarthritis per se. It could be a neurologic problem, meaning there's a nerve deficit to a back leg or a nerve problem over the spine. And we can obviously diagnose this on our physical examination. Putting that aside, let's get to the physical exam, basically going through every joint. We do range of motion. We measure muscle girth on our animals. I watch them walk, both at a walk and a trot, to make sure that I can see them. Basically we look for what we call head bombing a lot of times, which means in a front leg, if the leg is having an issue, the head will actually come up when the dog puts the leg down. So there are some really specific techniques that we've learned through our rehabilitation certification to make that physical exam and diagnosis.
You brought up an interesting point earlier on in this segment about dogs and cats. I guess one question I have would be, is arthritis in cats as prevalent as it is in dogs?
It's actually sometimes considered more prevalent. But the issue is that as our cat owners know, we have a separate cat practice called Feline Focus at Paws here in Tucson. As our cat owners know, many, many times a cat isn't going to show their owner that they're having an issue. And the question is, well, why is that? Because cats are still really one step away from being feral or wild animals. And in the wild, many times our cats, if they show that they're having pain, will get eaten. I mean, that's plain and simple, but they just can't show a problem. So they don't show it. And the way we pick it up is obviously on our yearly or biannual physical examinations, we're able actually to find it. So that's a great question.
Huh. That's so interesting. And is arthritis breed specific, or if it's not breed specific, and I'm talking dogs now, is it more prevalent in some breeds than others? Obviously retrievers and shepherds, it's like, oh my God, it's just there.
Sure.
You better expect it.
Sure.
But how does that work breed-wise?
No, that's a great question also. So, think about, the breeds you mentioned obviously are, German Shepherds, Labradors, Golden Retrievers, all the retriever hunting dog breeds have a tendency toward it because they're worked really hard. Most of them are out in the field, or they go do dog sports and this and that, and we will see that show up down the road in those animals. Of course, there's also a genetic predisposition. That's what you're kind of alluding to, is that some breeds are set up to have like cruciate ruptures or hip dysplasia. But also I want people to think about the long back dogs, the Doxies, the wire-hair fox terrier. These animals are very susceptible to problems over their back because of the pressure of the back, also because of the short legs, and many of them have what's called a valgus deformity, where you actually look at your dog and your legs are pointing outward, and that puts incredible pressure on these animals over time, where they're going to have issues. So, the question is it breed specific? Not really. I mean, we see it across all breeds. Some breeds are much more likely to have certain types of conditions, as we're talking about, but many, many times we see it across all breeds, to tell you the truth, Mark.
So just to clarify for a second, when I'm listening to you, are those arthritic conditions even in the long back breeds, or do they tend to be more neurological?
They can be both. Many, many times they're a disc problem. And when we talk about discs, the way the spinal cord is set up is you have vertebrae, cartilage, disc, cartilage, vertebrae. So a lot of times the cartilage gets stiff or inflexible, and the disc starts getting pushed up into the spinal cord because of some arthritis or new bone being set down in the dog's back. It's called spondylosis. But then we see disc narrowing, and that leads to the neurologic issue. So it's a pain and neurologic issue in that situation.
Huh. A little bit stenosis? Is that like
exactly.
stenosis?
That's exactly what it is. Yep.
Wow. Okay. There you go. So let's talk a bit about inflammation. And I hate to say it this way, but I love the topic, because the more I know about inflammation, and I'm talking humans now, the more I know, or the more I've learned, that it's the root cause of so much chronic disease.
Sure.
So we're talking specifically today about arthritis in our pets, right?
Right.
But let's just have a conversation about inflammation, and then maybe just take it right into the arthritis.
Sure. So let me back up just a little bit and mention two other things that I didn't mention on the examination. And that is, we always want to check recent lab work. This leads to your question about inflammation, because many times we'll actually see markers of inflammation in that recent lab work. Now, in some areas in the United States, like in Arizona, California, we have something called coccidiomycosis, which is valley fever. And this is a fungal disease that causes bone changes that can cause pain and inflammation. And we do pick those up on blood tests. But in other areas of the United States, we have blastomycosis or histomycosis. These are also fungal diseases. So we're looking for all of these things. Another thing that we would look for is the tick status, meaning, has the dog had Lyme's disease? Has the dog had ehrlichiosis or tick fever? These are very critical in making sure we manage that inflammation or that pain and whatnot. And then lastly, let me mention that many, many times we'll take radiographs or x-rays. And these are very helpful. They're not specifically diagnostic for neurologic disease. I mean, often that takes an MRI or CAT scan. But these x-rays can really show us early changes many times in the joints, in the back, and allow us to move towards to helping that inflammation. So I wanted to mention those because I didn't want to forget that part of the diagnosis, because people think, oh, you know, sometimes the doctor can just feel this and it's over with. No, we actually require, you know, for us, as you mentioned earlier, some of the allopathic things, the lab work, the x-rays or radiographs, because they lend to our integrative and rehabilitative work to treat the disease. So let me go back to your question on inflammation, because it's a really good question, but it is the bottom line of many of these things that we're talking about. It is the foundational problem that many times veterinarians will often treat, you know, signs or symptoms of the arthritis, but never really getting to the bottom of where is this inflammation starting that's causing these changes. And so we talk about foundational medicine, where we talk about a number of different things. I know you and I are going to talk about testing that are very specific for this. But getting, you know, the diet starts becoming the real issue. Do you want me to get into that as far as that goes?
What I would love you to do, because you've
Sure.
now mentioned the word foundational twice, and I think it's a big word. But not everybody might know exactly what you're talking about, and it's at the core. It's at the core, I think, of what you do. Am I right
Perfect.
about that?
Absolutely.
So,
Absolutely.
just explain that a little bit. Let's learn about foundational and what you mean by that.
Sure. So when we talk about foundational medicine, I like to mention Peter Attia, who is out there, who is an MD, who's very, very bright, and talks about medicine 2.0 versus medicine 3.0. For us, medicine 3.0, which is really the advanced look at some of these things, is when we start looking at foundational medicine. So when Mark's question about foundation is what is going on in the dog's food environment, absolute environment where it's living, activity level, that leads it to the kind of situations that we could possibly see causing it a problem, or even better, maybe not, and if we got the foundation right, it's good. So when we talk about foundation, we're talking about really diet and also looking at exercise and environmental stuff too. But diet really becomes the number one topic, because so many of our dog diets are inflammatory. So, you know, when we created a kibble society back in the 70s, we created this very false situation where, you know, if anybody understands the situation in dogs and in cats, they really have a zero carb requirement, meaning their carbohydrates, you know, they can get from their vegetables. They don't need them from all of these other things that are added to kibbles that cause issues, and getting back again to this foundational question.
So diet is at the core of it.
It really is. I mean, it's something that no matter what my animals come to see me for, when I do my 1-hour consults or my telemedicine consults, we talk about diet almost number one. Because I want to, yeah.
Sorry. Do we also talk about, because we're talking about the foundation of something. So a foundation is built from a few different parts.
Correct.
And you're saying the fundamental part of that thing is what they're eating.
Absolutely. And then, you know, we move to supplements, and then we move to, you know, environment and stuff like that. So we touch on all of those bases, obviously.
And you ask about exercise, I take it, and what kind of stress the dog is under, and all those kinds of things. Right?
Absolutely. Absolutely.
Yeah.
Because this all becomes incredibly important to build a therapy protocol for that animal. We call it multimodal therapy, but when we say multimodal, we mean diet, supplements, exercise, you know, possibly changing the environment. I mean, all of those things are things that we might have to look at to help your pet.
So we're building the whole story for this dog's health, and we start there and we move on. So that's what you're saying, I think. So
yeah.
I love this thing about dogs don't need carbs. That's probably coming as a surprise to some people. You're talking about things like rice and white potato, corn, wheat, those sorts of things. Do you want to talk a bit about that?
Yeah. So the two things that I talk about initially with my pet parents when I'm seeing them or talking to them is we want to eliminate all simple carbs from our dog and cat's diet. And when we say simple carbs, Mark also pointed out white potato, rice, soy, corn, and wheat. and all of the things that look like those in kibbles, in their food. I mean, we even see, better supposedly lightly cooked diets that still have white potato in them. And the question is, why do they do that? And the answer is because it's a filler and because it's less expensive. But for our pets, what that does is turn to sugar and basically cause inflammation. So we want those 4 things out of their diet. The other thing that I mentioned to my clients right off the bat is something called thermogenic property of food. It's a Chinese medicine principle. I'm also certified in Chinese medicine. And when the Chinese have looked at foods in us for thousands of years, and the correlate to our pets is very strong. And that means, like in a situation where we're talking about arthritis today, let's say, cancer or allergy may be the same thing. We don't want anything in the dog's body or cat's body that's going to create heat. And when we say heat, think about this. In human situation, like a habanero pepper or ginger is hot. Watermelon, cucumber is cold. Everybody can probably understand that. There's a wonderful book written called 4 Paws and 5 Directions by a woman by the name of Dr. Cheryl Schwartz that talks about all this if you want more information, because it's a very basic primer in this world. But what I try to do here in Arizona is get 3 of the hot meats out of their diet. And I focus on lamb, venison, and chicken. So I don't want any of those in my dog that I'm treating's diet, because it's basically very important that that they don't have that heat, which would create more heat in their joint, more inflammation. And it's very, you could probably understand how that would work.
Question for you on rice, since
Yes.
I imagine it's a very popular filler.
Yes, it is.
So my question would be, are all rices created equal? Meaning brown rice, white rice, and wild rice?
So wild rice is actually a grass. So it's actually acceptable. But you won't find a lot of wild rice in animals' dog foods. You're not going to see that. You're going to see white, brown, and the iterations of those. So no, I mean, wild rice is actually okay, but white and brown, not so much.
And the point being that as the dog digests them, they turn into sugars, and sugars cause inflammation.
Right, they're a simple carb, exactly.
Okay.
Can I mention one other thing too, Mark? Just as a
Sure.
reference, another place to look for a lot of this is a book called The Forever Dog by Dr. Karen Becker. And she talks about a lot of these things so you can understand the science behind a lot of it, which you and I won't have time to get into. But it's a great primer.
So to our listeners and people watching us on YouTube, we're going to expand our show notes. So anytime Dr. Randy mentions something like a book, for example, or a testing facility, we're going to put that with links into the show notes. Not to worry, you'll find them there. And so maybe, Dr. Randy, this is a good time to mention that we're going to be starting a new thing with you called Ask Dr. Randy.
Yes.
And you've been getting some great questions off your Facebook page. I know that. And what we'll do is we'll create some shorts for Instagram and TikTok with a bunch of questions each week. But every 2 weeks when we do this podcast, we'll have another question. And this question will actually go onto your website, drrandyvetpet.com.
Yep.
Okay? So since I've recently had a question for you about this dark brown smelly wax in my dog's ears, and my dog is a 5-year-old white lab. But prior to him, I had 2 golden retrievers, 2 male golden retrievers. And growing up, I had an Irish setter, and she had the exact same problem.
Sure.
And I talk to a lot of people I see in the dog park and whatever, and a lot of their dogs have the same problem.
Yep.
And so, in fact, I'm taking my dog to the vet in about 2 hours to deal with it and get rid of it. But maybe that's a good way to segue into the question. I'm going to take the dog to the vet. The vet's going to clean out his ears, and we're going to treat it probably with some kind of antibiotic, antifungal, whatever. And I know the problem's going to go away for 30 to 60 days.
Right.
And then what I know is it's going to come back. And it
Correct.
typically, at least in my experience, comes back in one ear. In Hank's case, it's his right ear.
Right.
So enough said. What can people do to deal with what I think is a chronic problem what is this brown wax? Is it bacterial? Is it yeast? Is it a fungus? Like, what is it? And how do we just get rid of it once and for all? And I'm thinking that this whole foundational approach that you take might be the answer, because the antibiotics are not the answer.
Totally, totally. So great question, something we see a lot. So when you get that brown wax production, you're getting that because of inflammation in Hank's body. Basically, that is coming from his gut, believe it or not. We talk about microbiome. So 70% of all of the immunity in our animals is in their GI tract, just like ours. So microbiome, which is the millions and millions of bacteria and yeast and fungus, have to be balanced. And when they're not balanced, we get something called a dysbiosis. So fancy word, it just means that this is not in balance and it's creating issues. Well, what kind of issues does it create? It creates something called leaky gut syndrome. People have heard about that. You can see it online. So what happens is our small intestine is what's called a semi-permeable membrane. And I'm not trying to get real technical, but I want people to understand how this works.
Yeah.
It just is supposed to keep things out of the body that's not supposed to be in there, meaning the lymphatics and blood system. And it takes things in that we're all supposed to have and get. And many times when you have leaky gut, these openings open up and allow things in that shouldn't get in, or keep things out that should be in. And so this creates an inflammatory condition in the body. And the way Hank is responding to it is in his ear. He's producing dark brown wax. It's kind of a protective mechanism for Hank. But what happens is the ear is an L-shaped canal, not like ours. It doesn't go straight into their head. Some of us you can look right through, and you won't have. That's teasing. But the ear canal is an L-shaped canal, and we don't see a lot of time. We see what you're seeing in the vertical area of the canal, but many times it's really also very bad in the horizontal canal leading up to the eardrum. So this wax blocks airflow into the ear, and then when you have this dysbiosis in his gut, you have the wrong amount of bacteria, yeast, and fungus that's building up. And so what happens in the ear is he not only gets this wax production, but he gets many times yeast and bacteria. And when we see a dog like Hank, the first thing we do is smear that wax out, look for yeast and or bacteria.
Under the microscope.
Under the microscope, that's correct.
Yeah.
Yep, it's called an ear cytology, which should be done. And then when you determine what you have, you can treat it accordingly. But what Mark is alluding to is many of us, what we do is we clean the ear out in our veterinary office. We put a product in that can last 30 days that has an antifungal, anti-yeast, and a steroid. And it'll calm everything down for 30 days, 60 days, 90 days. Sometimes it'll calm things down for 6 months, but it comes back. And Mark is absolutely right. The reason it comes back is no one has addressed what's going on in that gut that's producing this problem.
So it's not just, because what you'll hear people tell you is, well, if his ears were straight up,
right.
They wouldn't get wet inside or down.
Right.
But a retriever's ears are down over his head.
Right.
And so they're not getting air in there. But then it would be in both ears if that were the case, to be honest.
Well, not necessarily, but yes, most likely you're right. But the thing is that obviously the erect ear dogs tend to get some of these infections a little bit less because there's more airflow. But it doesn't preclude. I mean, we see plenty of erect ear dogs where they still get this problem. And again, it's because someone hasn't talked about the foundation, the diet, the supplements, ear care. So these are all things that we would get our owners enlisted in, and there's ways of doing that through testing and whatnot too.
And then you think the problem can actually be solved. Is that right?
I've seen it. I mean, some people will come in and say, my dog was on this dog food, I switched it to this dog food, and it got better. Well, yeah. I mean, there's a little bit of an incidents where you can see that happen, but for how long? Because if they didn't switch it to what we're talking about, which is that non-inflammatory, non-simple carb, no heat-producing Chinese medicine meats and whatnot, you're going to have it come back.
And what do you use to clean out the ears, which probably once a month or so?
So I usually recommend to my owners something that I do with my dogs, which is Bragg's apple cider vinegar, 50% of that, 50% water. I mix it up. I really drip quite a bit into the ears so that when I massage the lower parts of the ears, because you want to hear it squish around, okay, or you don't have enough liquid in there.
Is that a teaspoon, a half a teaspoon?
You know, it's hard to say. It's probably quarter to a half a teaspoon. It doesn't take much.
Okay.
And I drip it into the ear, have my owners, massage it around. Your dog's going to shake its head and, throw some of that wax out of there, throw some of the Brags out of there, and then a cotton ball, very lightly to clean. Don't go in with a Q-tip if you can help it, because some people will go too deep and push that wax down, makes it worse. But that's kind of a maintenance product that I would use for cleaning the dog's ear. And there are actually some really good also products that your veterinarian have. You mentioned earlier, a long time ago, we talked about OtoCleanse. There's Triz EDTA. There's Duoxo. There are some really good products you could clean the ear with too. So if you don't want to do the apple cider vinegar, you can ask your veterinarian to have them prescribe one of these cleaning solutions also.
Cool. And again, we'll put all that stuff that he just mentioned into the show notes.
Yes.
So, okay, well, that was our first Ask Dr. Randy, and that was a pretty that was a deep dive for just a little segment, but good. But it's a great deep dive because it's a condition that I imagine you see a lot along with other conditions, and so it's probably a great segue into testing.
Yes.
And getting to the foundational health of the dog.
Yep.
And why don't you talk a little bit about what kind of testing you guys do?
Sure.
Biome and whatnot, and let's see where that goes.
Sure. So most people are used to regular blood tests, which are very helpful just to rule out any other underlying systemic conditions. But what I get my animals here, many times that's been done. And it's unremarkable. It's not rewarding to give us any information. The two things that I get my owners to do is, one, some kind of food testing, and you can do what's called food sensitivity testing. There's a great company called NutriScan. My good friend Dr. Gene Dodds created this test, and it's a kit that you can order online, and it comes to you with swabs. You get your dog to salivate, you swab or your cat, you swab the inside of their mouth, you send it to NutriScan, and in 10 days, we find out, are there any foods that we totally want to avoid, besides, remember, the chicken, lamb, and venison we've already talked about. So it can be very helpful in that world. If people want to get more aggressive, then there's another laboratory called VDI Labs. Another Randy runs that lab, and it is a blood allergy test that also will give us a lot of information, not only on food, but also on environmental stuff, like is there mold in the house? Is there mite problems that we're seeing in the house? People don't know that dust mites are everywhere, and some dogs and cats are very reactive to dust mites. You can have, my wife is the cleanest, most fastidious person you can imagine. We had a dog that came back allergic to dust mites. And, going, how's that possible? You could eat off of our floors. Well, they exist, and, with a good HEPA filter, you can actually take care of that. But so that NutriScan testing or VDI lab testing is number one. Number two, and Mark mentioned this, is called biome testing. So I use a company called Animal Biome. They're a great company. They started out of California. They have been doing this for years now. They've looked at well over 100,000 fecal samples on dogs and cats, and they will do the DNA testing on that fecal. And that means they're looking for all of the good and bad bacteria and yeast and fungus that's in that microbiome, and how do we change it to make it right for our animal in question. So it requires a poop sample. You can get what's called their gut test online from animalbiome.com. And we do this through our practice, but people that are listening can do this. And when you have those two pieces, the biome report, which is a 10-page report. It's very comprehensive. And the food sensitivity or VDI allergy testing, now we have the basis for building our dog or cat's diet and how to address that inflammation that you were mentioning.
I hope you don't mind my asking you this question, but so someone listens to this and their vet is not you. I mean, they're not a homeopathic integrative kind of guy, kind of gal, whatever.
Right.
They're just traditional.
Right.
And so someone brings this up to their vet and they don't even know what you're talking about really. Or even if they do, they've heard something about it and you bring these test results and they won't necessarily know what to do with it.
Right.
What does someone do in that situation?
Well, I will tell you that that given those pieces of information, it's pretty easy for a veterinarian to look at the NutriScan report or to look at the Animal Biome report. Now, as far as what to do for the NutriScan, it's pretty simple. You want to cut out any of those sensitivities or the VDI test from the animal's diet. So it's really interesting because many times that report comes back with 4 or 5 things that are bad, let's say for our dog or cat. And I actually send that report with my owner to one of the local feed stores here in town, which does a beautiful job because they have such a plethora of dog foods of any kind, and make sure that we find a diet that doesn't have those things in them. You can also use that report through an integrative veterinary dietitian. There are some really wonderful people out there that can formulate diets for your pet, not incorporating those things in their food. Okay.
Is there an organization people can look to online to find a holistic or integrative vet or nutritionist in their area?
The American Holistic Veterinary Medical Association may have that list. I think if you just Google that situation or send me an email, and I'll send you some information on Donna Radatic or some of these other people. You've talked to Linda Case, who's a wonderful person with this stuff. I'm not sure she's now formulating diets anymore for people, but there are people that will do this for your pet. And a lot of times, even like a company like the Farmer's Dog, which does lightly cooked food, will take this information and make sure that Hank's diet doesn't have rice in it or whatever he might be sensitive to.
Oh, no, that's brilliant. So it actually brings me to something that I wanted to mention earlier, but I didn't. I forgot. One of the things that I love about your approach, this approach, is that it's anything but a one-size-fits-all approach.
Correct.
I mean, at this point, we're really looking at, as you say, the animal's foundational health, which is going to be, while there are common themes, obviously, it's going to be different for each animal. And you're saying, in this case, here's what we will do. And the next animal that comes in, the next pet, it might be something completely different.
Absolutely.
To get at the arthritis, which is the common denominator.
Right.
Right. But the foundational health you might find is quite different for each pet. And therefore, the course of treatment and how you manage it is also going to be different. And I think that's one of the, in the a more traditional approach, somebody comes in with arthritis, give them this pill, and that's oftentimes, even today, how far it goes. So you can see why I love this, and I get excited about hearing you talk about it, and I hope everyone else, does too. So. Okay, so that's a pretty good rundown on the testing, right?
Yep.
Let's move on to, so we've done the diagnostics, we've done the testing, we see what's going on. One question I have is, I think this is really important. It's actually a question that relates even to the ear condition we talked about earlier with Hank.
Sure.
You find the arthritis, or you find the condition in their ears, and there's, for lack of a better way, since I'm just a regular person, you're dealing with an acute situation. The dog is obviously uncomfortable. The dog is in pain.
Right.
And am I right to think that, okay, so let's treat the infection in a very traditional way. Let's get rid of it.
Right.
And let's get the dog out of pain.
Right.
And get the dog comfortable. And then we begin to look at, we can simultaneously be doing all the testing, but then we look at something to sort of keep the acute nature of the condition from coming back and we manage it more as a chronic one. Does that make sense to you?
Absolutely. It makes no sense for someone like myself to go through all of these ramifications of looking at foundation and whatnot without dealing with the issue. So if the issue is pain, yes, we have to deal with it. And whether we deal with it through, let's say, an NSAID like Rimadyl or Meloxidil or Deramax or gabapentin or amantadine, or we deal with it through something like Adequan, which is a natural product that we actually give that makes the cartilage imbibe water. We use this through our rehabilitation protocol that we do here at CoLab. But we've got to get rid of the pain. There's no question. I mean, I can do all of this stuff, but if the dog's still hurting, I'm going to get a call in a day or two like, come on, my dog's still really hurting. We didn't do anything.
Yeah.
Well, we will definitely do that. One thing I want to mention, and we're kind of going back and forth, but when you said the ear thing, so my concern about the ear thing is that I don't want to see that dog on oral antibiotics if I can help it. Because now we're going to mess up that biome. Because oral antibiotics are the reason why, like in the situation with women, they get candida, which is a yeast infection. The reason why they get that is their biome is all out of whack because they've been on so many different oral antibiotics, we don't know what is right anymore. So in the ear situation, that's treated topically, okay? Where we talked about cleaning, putting something in the ear. Great, let's leave it right there. Don't have to complicate matters by putting it on an antibiotic, okay? So in the pain situation, yeah, we have pain medicines, and they do alter the biome somewhat too, I agree. But we haven't even talked about supplements yet, which really will help many times lower the necessity for some of those pain medicines and also aid in the multimodal therapy we talked about.
I think I hear you saying, let's talk about supplements.
Yeah, let's get to it because I want to make sure we have time to do that. So, so again, on these types of arthritis cases, there are set ones that I would always go to and talk about. One is a really good source of omega-3, 6 fatty acids. Omega-3, 6s are from fish oil. They can be also from plant oil. There's vegan-based ones. We don't want omega-9s. They're inflammatory. So a regular fish oil capsule has 3, 6, and 9 omegas. We don't want that. We can do an omega-3, 6 from fish base. There's a product called Omega True Benefits or Dermaquin, which is made by Nutrimax. These are companies that do make these products. There's also over-the-counter ones. We want that. Why do we want that? Because omega-3s and 6s are anti-inflammatory. They're also joint moistening. So they moisten the joint through the, it's almost like thinking about the Tin Man in Oz, but using an oil can. We're trying to get some moisture into that joint to help the cartilage. Go ahead. You were going to ask?
Just because I know a tiny bit about this, EPA omega-3s and 6s?
Yep, EPA, DHA, yep.
You want to just mention that? Because they're not all created equal, just like rices are not all created equal.
Well, again, most of the time, like, you're really looking to get the omega-3, 6s in there, which is usually EPA, DHA, or DLA, I believe. I'm not up to date on all of the omegas, but there's lots of them out there. We're just trying to avoid omega-9s, and I don't remember what the omega-9 initials are, quite honestly, right off the top of my head. So that's really number one. Number two is everybody comes in on their animals being on a glucosamine product. And, there's some really good glucosamine products like Dasaquin Advance is a really good glucosamine. But recent research, and my good friend Christine Colomanico through a company called Pet Jope, have looked at the last 2 years, there have been 9 research papers to show that a product called Ultra Collagen 2 is much better getting into the joint and helping with the inflammation and moistening the cartilage. And so Ultra Collagen 2 doesn't have to get through stomach acid like glucosamine does. So we use a lot of JOPE, J-O-P-E, which is Ultra Collagen 2, turmeric, and it does have a little bit of omega-3s in it also. And that's a great supplement. It's a chew. Most dogs eat it readily. A great supplement for our dogs. And then lastly, a lot of times many of my dogs will come in, let's say if they have one affected joint, with some muscle wasting, meaning we measure the girth of the muscle, and let's say the dog's back left leg is 29 centimeters and the dog's back right leg is 23 centimeters. That right leg has had muscle atrophy because it's not being used properly. And so there's a product out there that came from the human world called Myos. They used it in us when they were doing shoulders and knees and hip replacements so we wouldn't lose muscle. It stops naturally something called myostatin, which is the enzyme that breaks down muscle. So we use Myos canine in the dog. And what it does is it stops the muscle breakdown while we're working to build it up through our entire rehab program that we do. Those are three basic supplements that I would point people in the direction to.
Okay. I think we're ready to sort of wrap this up.
Okay.
We've passed, unless there's anything else that you want to say that we haven't said so far, we've talked about a lot. We've kind of gone deep. I think a good way to end this show would be, we've gone through all this. What is my long-term, for arthritis, for pet arthritis, and an integrative medical approach to, joint pain and to arthritis, what does a treatment program typically look like? So the dog is coming in, he or she, or the cat's coming in 7, 8 years old.
Yep.
Right? And they've got 5, 6, 7 good years left
At least.
life.
Yeah.
At least. So what's it going to look like for the patient and for the client?
So, to summarize, we've now worked on food, we've worked on supplements, we've looked at certain testing to elucidate what's going on. So our protocol would be, in most of our dogs, let's say, a rehab protocol, meaning we would utilize things like underwater treadmill, cold laser, therapeutic ultrasound, pulsed electric magnetic therapy. These are things that most practices don't have, but this is what we do here at CoLab as part of Paws Veterinary Center. And that is just to strengthen the animal, to get that area, let's say it's one leg, to get that leg stronger, to get the nerve memory to be forgotten. Because once they get in water that's up to their groin, 70% of the weight is off of that dog. And so now they can utilize that joint properly, along with, we give our owners therapeutic exercises to do at home. So the long term is we will do that short term, obviously, till we get to a point where we feel like they've made some progress. We've built up some muscle. They're using the leg better. They don't have as much back pain. And then basically because of the exercises, because of the food and supplement changes, we'll check that animal out in 3 months and 6 months and see how we've done. Sometimes they want to stay in rehab longer. Sometimes they want to do Adequan, which is the injection I explained to you, do it longer. But these are the things that we're working at being proactive so that we're not seeing their animal. I laugh about chiropractors because I tell people I'm not a chiropractor, so I don't need to see you every week to treat the problem. We want to get it on a protocol. Let's say it's a 4-week bi-weekly treatment in rehab, and then graduate this animal. And we've done the same for cats many, many times. We've actually had cats in our underwater treadmill, if you can believe that. And, these are things that we can do, but it's a matter of we're trying to get proactively on a situation where we don't have to see that animal all the time. We're not dealing with the chronic pain issues all the time, and we're really building that animal up or being proactive. And Mark, let me mention one more thing, because I didn't mention this, and it's very important. The other thing is pet obesity. So we talked about food, we talked about simple carbs. Many of these animals are overweight. 59 to 60% of our pets, our dogs, are overweight. In cats, it's even higher sometimes. And so if we address the things we talked about with the simple carbs and getting them on a better quality protein diet, many times the weight will come off. They're in rehab, so now they're exercising where they can move. The weight will come off. But I see veterinarians where, especially surgeons, that are operating on dogs' knees, let's say, to do, a TPLO for a cruciate repair, never talk about diet. And the dog is humongous. So what's going to happen? They're going to get that knee better. The other knee's going to tear. We've got to be proactive about all of this, and obesity is a huge problem in our pets.
Well, if you don't mind my telling you just a story for a minute. So Hank comes from Colorado, where I lived for a couple of years. And just like the people out there, the dogs are in good shape.
Right.
Now I'm on the East Coast and I'm walking, him all over the place. And the dogs here are a lot heavier. And it's interesting. And I was in the park recently and I came up to some guy that had a white lab just like Hank. And the first thing the guy says to me is, when are you going to start feeding that dog?
Right.
Now, Hank
Right.
is 86 pounds.
Right.
He's perfect. He's a perfect weight.
Right.
He eats all day. And my comment to him was, when are you going to stop feeding yours?
That perfect question. Perfect
And
question.
he just laughed. But
Yep.
a lot of these dogs are huge. And
Yep.
I will also say, when I look at, I'm not innocent here because I look at pictures of my last dog, my golden, and I could not believe how heavy he got.
Yeah.
And you don't see it.
Right. Right.
You live with the dog every day. You don't see it. Eventually, he did trim down. But that's just kind of a funny story. And yes, we see these obese dogs all the time, and it's actually quite sad.
Yeah, and let me tell you something that's very interesting statistic. When we talk about the 59 or 60% of dogs that are overweight or the cats, when you ask the owners, is your dog overweight? Less than 6% of people will say yes. And the number we're looking for is something called a BCS score, or body condition score. That should be on every veterinarian SOAP, meaning your examination. BCS is graded from 1 to 9. Some people do it 1 to 5. We like 1 to 9. But 5 is ideal. And that means you look at your dog from down below, and there should be a waistline. You also should be sometimes able to see a little bit of rib. But those people that see Hank in that condition will say, oh, he's too thin. But not at all. Not at all. So just be aware that the BCS score, and there's a great website called Pet Obesity. Just look at it online, and you can find all this information out too.
Okay, there you go. So I have one last question. It's kind of philosophical, and then we're going to conclude.
Sure.
Okay? As part of your treatment protocol with this underwater treadmill and all the things that you're doing, is one of the ideas in the type of medicine that you practice to get the dog or the cat off as many of the meds as possible?
Yes. Plain and simple, yes. Because there isn't a medication out there that doesn't have side effects. And many times there are 2 or 3 side effects. And so a lot of times we're dealing with medicine problems and not, just foundational problems. I mean, medicine's causing some issues. Now,
Right.
As we've talked about, in integrative medicine, we believe in allopathic, we believe in medicine, okay? But to a limited degree. And the bottom line is that many of these medicines are causing us problems. So the goal for me as an integrative vet is to have them on the healthiest protocol possible with food and supplements and the right type of exercise, and trying to avoid some of these. Now, not all of them. So, for example, in pain, I like gabapentin because it's a pure pain product. It has little effect on the kidney and liver in a dog or cat, whereas Rimadyl or Vetprofen or Carprofen is an NSAID, and it can ulcerate their stomach. It can cause liver and kidney issues on a long-term basis. So again, these are things that we can trade off and hopefully work towards using something if we need to, but much safer.
Okay, I love it. Well, I think this was great.
Yeah.
I learned a lot. We got through a lot, and you've answered a lot of my questions. And thank you, and thank you again for having me.
Sure.
And if you're a listener or watching this and you got a lot out of this, hit the subscribe button
Absolutely.
on YouTube. Follow us on your favorite podcast app, and like us and comment and send in those questions. Join us on our Facebook page, Dr. Randy Pet Vet. And I look forward to the next one. In fact, why don't you mention the next one, episode number 2 of season 2? It's going to be very special.
Yeah, I mean, for those of you listening, and if you're not, pass this on to your friends. In 2 weeks, in episode 2, we have Dr. Andrew Weil, probably the foremost integrative MD in the world. 8 bestseller New York Times bestseller books, has his own gigantic integrative medical center at the University of Arizona, started Miraval and many, many other type of projects. And this guy is the person that really stimulated me to get into all this. And this was many, many years ago. I've been practicing for 43 years. 30 of those years came because of Dr. Weil to really change and give you this kind of information. So if you get a chance, make sure you get a chance to listen to episode 2 also, because it'll be incredibly informative. I'll tell you, you won't miss anything, and you will learn a lot from this man. He's a wealth of knowledge.
And I think episode 2 should be out at the very end of January, just FYI to people.
Right.
Okay. All right. Let's wrap this up. Thank you so much. It's great to see you, and I look forward to the next one.
It was great. Enjoyed talking to you.